Hello, everybody. This is Hadley Morrow with Better Health Together. I am Associate Director of Community Engagement here at BHT. Thanks for joining us for the second webinar walking through our transformation plan template for our Community Health Transformation Collaborative and partnering providers to start to fill out over the course of the summer. Today's webinar is meant to overview what the expectations on these transformation plans are for both the collaborative and partnering providers, and be an opportunity for Q&A from any of you that might have questions on how to approach or fill out these plans. In the interest of time and organization, it is my preference that we hold questions until the end of each section of this PowerPoint. So for right now, I have everyone who is in the audience on mute. And at certain times throughout the call, I'll go ahead and unmute so you can voice questions. You're also absolutely willing to drop questions in the chat box whenever one appears to you, and I will read it out during the pauses throughout the presentation. We are recording this webinar, and it will be posted on the collaborative section of our webpage and on our YouTube so that you can go back and reference it as you're working on our plans. We will be sending out a link to this webinar along with answers to any of the questions that may arise in a Q&A document to help support your work moving forward. So with that, I will dive right on in. I want to give a quick shout out to HMA Health Management Associates who have been helping us greatly, both in compiling this plan and getting it out to you all. They've also created this PowerPoint walkthrough for us, so I just want to give a shout out to them. So we've talked a little bit about the goals here today. We're just going to do a quick reminder of sort of what the project requirements are, overview of the plans, do a quick look at a quick timeline for how we're asking folks to submit and when, and then open it up for question and answer. So as a quick reminder, the ACHs, all 9 of us across the state, were required to select projects that came from the Transformation Toolkit that was developed by the Healthcare Authority from recommendations of evidence-based practices that came from the community. So each project area has an approved list of evidence-based models from which the ACH and all of our partners can select to take on. The BHT staff and our network of technical councils, including our Provider Champions Council, Community Voices Council, Labor Finance Council, have looked at these models and helped to create a framework that we use to form this template. So it kind of distills down what are the key elements necessary in each project, and hope you guys can easier synthesize what's being asked in each of the projects in the toolkit. Each project comes with a required reporting and performance metrics. So these are outcomes that we're hoping to achieve through the project. And over the course of the transformation, you all will be asked to report on progress from these performance metrics. And starting in year 3, some of the incentive dollars will actually be earned by success on these performance metrics. So last fall, the BHT board selected 4 project areas out of the 8 total project options. Bidirectional integration of care and addressing the opioid public health crisis are both required projects across the whole entire state. And then BHT also selected chronic disease management and community-based care coordination as our 2 additional projects. In addition, BHT board has approved 4 regional goals to align with transformation efforts. These are speaking to some issues that are community priorities for Eastern Washington. These include reducing unintended pregnancies, improving oral health, increasing behavioral health access, and reducing jail recidivism. And strategies and activities that will support these goals are expected to be woven into the project plan. BHT has approximately $61.7 million available to us across the 5-year period. Some of those monies will be earned by pay for reporting. So as we hit the milestones, show that we've got people to the table, doing the trainings, getting the work to get their projects off the ground, we earn funds. As I said, starting in year 3, the expectation is we have to be meeting outcomes and seeing health improvement in our region to continue earning the total funds. This is a spreadsheet that shows which metrics are tied to each project. You have this in your transformation plan packet, so don't feel like you have to strain your eyes on this slide here. But as we see, there are a number of metrics that cover multiple project areas, including inpatient hospital utilization and outpatient emergency department visits are the two that span all 4 project areas. So those will be sort of big bucket metrics for us. As far as the timeline, implementation for these project areas must begin January 2019. So the rest of 2018 is really a planning year. We're building our plans so that we can hit the ground running January 1. BHT will be required to submit reports on these plans, both through a semi-annual report that's due to the state twice a year in the summer and in the winter, and then our implementation plan, which is due to the state in October. So the semi-annual report for the first semi-annual report is due in June. It's going to ask us how we are doing on getting assessments from providers, figuring out our current state, engaging providers who are active in transformation, and starting to work on our plans. The implementation plan that's due in October will be an aggregate of all of these transformation plans that you are compiling that summarizes sort of what the BHT regional plan for transformation is. By the end of the year, we will have to have partnering provider contracts in place, binding folks to what they have committed to do for the transformation period for the next 4 years. As you know, anyone who is participating in a collaborative has signed a collaborative MOU. That basically stays active until October when the regional implementation plan is submitted, at which point we will transfer from really the MOU being the commitment to actually signing contracts with each provider who is working on a transformation project. So these plans are really going to be the roadmap for how collaboratives and partnering providers earn money and do the work in the BHT region. They are going to describe different elements of work from the 4 project areas that we selected, as well as the 4 local goals. And there are 2 levels of transformation plans. So the first level is the collaborative transformation plan. That is across all of the partnering providers that take place in a collaborative. So we have 6 collaboratives, 1 for each county in the BHT region. Each one of those will be delivering a county-wide plan with input from all of their partners. In addition, each partnering provider who is in the primary care or behavioral health setting will submit their own partnering provider transformation plan that speaks specifically how they, inside their own clinic or shop walls, will be engaging in transformation activities. This recognizes that it's really the primary care and behavioral health partners who are carrying the bulk of the risk and being asked to make the majority of the changes throughout transformation. So we need to make sure that we are starting with a plan that works for their business models, and then adds on partnerships with other key partners like emergency department, social determinant of health partners who will support success of those projects. So while we're not currently asking partners outside of primary care and behavioral health to fill out transformation plans, we expect to see them listed in these plans as partners supporting the work of primary care and behavioral health players. Here is a graphic that's supposed to show how this all fits together. So as you can see up top in the orange here, the ACH technical councils set the transformation requirements. So they looked at all of the project areas and came up with sort of the key elements that were necessary for success. Those had been translated into sort of the guide for our transformation plan at both the collaborative and partnering provider levels. So by June 29th, the collaborative transformation plans are due. Those will be compiled by all partners in the collaborative. We need input from everybody to make sure that we have an aligned plan across all the different partners. Once that is submitted, the individual partnering providers will start to work on their individual plans. Our intent there is that the collaborative plan really happens first, so we have some regional or some county-wide alignment and sort of a framework to make sure that the partnering providers are fitting in with the overall collaborative plan and not developing work that is in a silo or might compete with the goals of the collaborative. Both of these plans will then be aggregated by BHT. There will be some back and forth period where we're reviewing the plans, giving sort of advising on where we might need more work or tweaks or need to add in new partners. And then once we finish the back and forth, we have to submit our version of the implementation plan to the Healthcare Authority on October 1st. So I'm going to pause there actually really quick, and I'll take everyone off mute to see if there's any questions sort of about the general timeline, the general vision for this before I dive into the details of the collaborative transformation plan. So you're all off mute if there are any questions.
Possible.
All right, I'm not hearing anything. I'm going to put the mute button on again and move us along. All right, so like I said, each of the 6 county collaboratives are going to submit a collaborative transformation plan that really serves as the framework for the individual partnering providers to start developing their own plans. Really the key goals of this are to make sure we break down silos and are developing cross-sector collaborations as we start to identify local priorities and approaches, so that we're really building a plan that is going to be sustainable for all of the partners because we have shared alignment. Some of the key goals of this plan are going to be really to describe the final governance mode for the collaborative. So each is going to be slightly different based off of the folks you have at the table who's signing up to take a leadership role and whatnot. So we'll need to see sort of your governance plan, which will take the form of writing a charter. We have some questions about your community strengths and needs. Some questions around aligning with the community-based care coordination project, and then looking at the framework and priorities for the different projects that we have agreed to take on. So it's just, important really for us to highlight how important it is to start from an aligned place, and that's why we're focusing on the collaboratives first. If we can make sure that all the partners sitting at the collaborative table have an aligned vision, I think this makes us more likely to succeed in year 6 when the ACH funding dries up and we have to move towards actually building a sustainable business model for all of this work and making sure there's a value proposition for it once there's no longer the flexible funding from the waiver. So I just love this graphic. Key to integration is rowing in the same direction. And on the other part of that is we really need each other in order to make this successful. So we have to have the collaborative table where we're all checking in with each other, because it is really going to require cross-sector partnership in order for us to meet these outcomes and pull off these projects. So diving into the details of the plan, it's going to start with some general information about your organization. We would like to see a lead contact established for your collaborative, really the person who can be receiving the emails on behalf of, for the whole collaborative. This is really going to be the person who's actually submitting the plan to us and would be able to take the emails back and forth about any updates to the plan and communicate out to the rest of the team. One of our first questions is looking for sort of an equity statement. The Healthcare Authority has added a lot of questions about health equity into our semi-annual report, which is signaling to us this is a really important thing to discuss and see as a fundamentally woven into our projects on every level. When we submit our semi-annual report, we're actually going to be asked to include some comments on how each project is accelerating health equity activities. So this is going to help us sort of draw on examples for how our region is promoting health equity. So first we have some questions about community-based care coordination. Each county is going to be asked whether or not they're going to participate in a Pathways pilot. This is a decision that we want made at the collaborative level. We have identified 2 potential target populations for a Pathways pilot. The first is the corrections population, so folks who are exiting out of jail. You might remember, our first pilot for Pathways in Ferry County is working with folks exiting the Ferry County Jail, and we're in the process of working on starting a pilot with Spokane County Jail. We then expect that we would add on additional work through the population of at-risk pregnant Medicaid moms. So here you're asked to check the box on whether or not you're interested in participating in a Pathways pilot with the focus of pregnant women or the corrections population, or both. If you do not intend to implement a Pathways pilot as your collaborative, we would then ask you to answer the question, how will you support community-based care coordination throughout your target populations and other projects? We really see that care coordination is an anchor strategy that will support many of the other projects as well, and we'd like to see your thinking for how you'll help coordinate care. Bidirectional integration. Here, you're going to start by just asking for your collaborative's general approach to supporting the bidirectional integration of care efforts. This here you'll be asked to draw on, and you'll see this in your packet, the key elements of the BRIE collaborative and collaborative care model, which are the two elements, or the two evidence-based practices identified in the toolkit. And talk about what your county-wide approach to integration is going to look like. We're then asking you to identify what shared strategies and approaches you might use across all of the partners. This helps us see where we can potentially support some TA or investment that will help all of the partners across your collaborative in reaching integration. We then want to see a little bit about how the individual partnering providers within the collaborative are going to approach bidirectional integration. So not at a collaborative level, but how will actually the primary care and behavioral health partners within your collaborative approach it. And then we are looking at sort of a statement on how the work that your collaborative is doing with integration is going to support the overall vision of transformation. And then our last question is really about sustainability. It's how do you anticipate scaling these projects in future years? We expect to start hitting the ground January 1, 2019 and implementing, but it does not have to be, we can start small and scale across the 3 years. So we sort of want to see your full vision for the whole transformation. How do you expect this project to grow? The next section is for chronic disease management. You'll see that the questions here are very similar. They pretty much mirror exactly what we've laid out for bidirectional integration. So first, describe the general approach for your whole collaborative. And then of the different strategies that are laid out in the toolkit, there are quite a few different actions for chronic disease management. So you'll want to make sure that you are using the toolkit, looking at the strategies and digesting it as you're filling out these plans. So take a look at those strategies and then comment on which ones you think you'll use as a collaborative. And then again, you're going to talk more about the specific partnering providers, what members of your collaborative are going to engage in the chronic disease management project. And then how will that project support overall goals of transformation, and what are your plans to help scale and make the project sustainable? The opioid use crisis questions for the collaborative plan are probably the most extensive section. There are 4 different levels of activity within the opioid project. And we have, while no provider is expected to do all 4, we do have to guarantee that the collaborative has a provider committed to each of the 4 strategies. So in this one, we are looking both for a description of how you are going to approach each strategy, and then also sort of showing that you have, we need to see here that you have a plan for each of the 4 strategies. So here we're asking, what's your shared approach? And then also, what specific models or strategies mentioned in the toolkit do you intend to use? These come under 4 levels. So the first is prevention of opioid misuse and abuse. The next is more intervention. So it's linking individuals with opioid use disorder to treatment services. Level 3 looks at intervening in overdose to prevent death. And then the 4th is really a recovery strategy. So how are you working to promote long-term stabilization in whole person care? You'll see that in the end, after question 4, we have, again, just those same general questions. Please describe what providers and partners are going to be involved in each of these strategies. This is going to help us know that you have a provider who is interested in each of these 4 different levels. And then also, again, how does this tie to the overall vision? and how will you plan to expand and scale these interventions? And the next section is just an overview of community strengths and needs. This section is really going to help us continue to refine what kind of TA support each collaborative could really benefit from. So first, we're asking for you to describe your strategies as a collaborative to make sure there is collaboration and coordination across all of the partnering providers and the other resources in your county. So here we want to see that you as a collaborative have some strategies to make sure that none of the partnering providers are building plans in a silo, that there are ways that you are all connecting to each other and keeping the work aligned. Next, we want to see you describe the value the collaborative will bring to partnering providers in your community. Really asking yourself, what can happen because you have the collaborative that couldn't happen without it? We really see the collaborative as a sustainability mechanism because we're trying to set up here the natural network of care that would be necessary to succeed in value-based payments. So we're really looking at the link. And I'm back. Sorry about that, everybody. I somehow hung up my phone. So, getting back to it, sorry about that. Just talking about strengths and needs, we want to see you give a general overview of any sort of strengths and challenges that you anticipate when you're looking at the specific activities related to the 4 project areas. Again, we really appreciate honesty here. No one is going to be penalized or at risk if you have a long list of challenges. This is so that we can help determine how BHT can best support the work that you all are undertaking. Similarly, the strengths is useful so that we can start to see where there are bright spots or successes in certain areas, sectors, or counties, so that if we find another place where someone could benefit from some shared learning, we can make those connections. All right, I am going to take a quick pause again, just seeing if there are any questions on the questions that are laid out here related to describing the project areas and sort of general collaborative work. So I've taken everybody off mute again if anyone has a question.
So I have a question.
Hey, Terry.
Hi. I was just curious if a county collaborative decides that they don't want to do all 4 of the projects, is there going to be a penalty there, and how does that? What impact does that have on the flow of the funds and all that kind of stuff? Can you?
Yeah. So we, will be looking at, especially. Later on, you'll see that one of the things that we're asking for you all to do is submit a budget for what you might need financial assistance from BHT. So really, it's going to look like if any county, if any collaborative does not take on a project, know that you won't be able to access dollars associated with that project. I'll remind everybody that opioids and bidirectional integration are required. Everybody in the state has to participate in those. So we're really going to need all of our collaboratives to take part in those activities in order to be successful as a region. But there is, I think, some more flexibility when it comes to community-based care coordination and chronic disease. So it really is on this pay for reporting, pay for milestone payment style that what you sign up to do is going to earn you money. So if you don't take on activities, you will not be eligible to earn dollars related to those activities. Does that make sense?
Yeah, that makes sense. Is there some sort of a breakdown as far as what percentage of the dollars is associated with each project, or is it 25, 25, 25, or do we know that yet?
It's not even. Each project is weighted differently. And I don't have that right in front of me, but we have a slide that shows the difference in how the projects are weighted, and I can include that in the notes that we send out from this webinar. So I can get that to you. For example, I do remember that bidirectional integration, for example, is the heaviest weighted project. The majority of the funds that we'll earn will be tied to bidirectional integration. And when you look at that earlier slide, I'll run back to the beginning, that has the all of the metrics. You know, the projects that have more metrics, so more X's on them, there's going to be more opportunity to earn money for those, because in year 3, when we switch to pay for outcomes, we will earn dollars based on seeing improvements in these metrics. So if you aren't working on a project, one of those projects, you're not eligible to earn the money for improving it, if that makes sense.
Great, thank you.
But I'll make sure to dig up that slide and include that in our FAQ about this, because I think that's a great point to highlight. Any other questions? Back to where we were. All right, I'm going to mute us once again. So the next section this really has to do more with collaborative governance and how the collaborative and all of its members are going to actually make sure that they're getting the work done. So our first request is that each collaborative complete a charter. This is a little different between Spokane and the rural collaborative. The Spokane collaborative has already sort of finalized a charter together. We had a separate work group that focused on the charter. So that part is mostly done, and unless anybody decides throughout the course of the next month or so that you want to make tweaks to that. For the rural collaboratives, I know I think there's one collaborative that's already finished their charter, but we basically just need you to click here. You'll be able to download a template that has the charter sort of outline of what we're looking for, and then we just want to see, your whatever you all come up with for just sort of governance. We want you here then to do a quick description of, actually the charter is going to ask for a quick description of sort of decision-making process. For example, are you guys going to choose to have unanimous decision-making? Is it a voting process, thumbs up, thumbs down, that sort of thing? And then also how you'll approach issues of conflict of interest. So that's all going to be covered in the charter. And then at the end of this document, we have an area where we're asking all of the partnering providers who are within your collaborative to actually sign, so that we can see that everyone agrees to the terms laid out in the charter. The next section has to do with really collaborative management of both this sort of administration of all the collaborative tasks and the funds that are eligible for the collaborative. So each collaborative, both the Spokane and each of the worlds, have access to some what we're calling collaborative management funds. That's money that goes to the collaborative that the collaborative can decide how to spend based off of needs that all of the partnering providers will have. So, it would be best to use this money for sort of what can you get the most bang for your buck, help the whole collaborative advance on goals. This might also be used for some sort of logistical things about actually getting meeting space, getting the groups together and whatnot. So we're asking here for a quick description of how you could see using those management funds, what's going to be most helpful for you in getting started. We are asking for each rural collaborative to come up with an entity that will really serve as the fiscal agent. So that is one organization that agrees to receive these collaborative management funds on behalf of the collaborative and then really be responsible for distributing it out to individual partners or purchasing whatever it is that you all decide you want to use the money for. So we want to see you name who that agent's going to be. And then we'd also like to know a little about how you plan to leverage other funding sources to support this work. 61 million sounds like a lot, but once you start to divide it over 5 years, 6 counties, and lots of partners, it becomes really clear that it's not enough. So we'd like to see where do you think you can leverage other funding sources, align with other opportunities to maximize our impact here. And then this last question, specific to the Rural Collaborative, each Rural Collaborative has access to a $50,000 Rural Accelerator payment meant to speak to the fact that our folks who are more rural have some unique challenges when it comes to doing this work. And so we'd like to hear, again, just a description of sort of what you plan to use those dollars for to support transformation. I'll add too that the Spokane Collaborative has a slightly different governance structure. We do not expect one organization to take on responsibility as the fiscal agent, but instead the Spokane Collaborative has settled on a collaborative connection team, which is a group of, I think, 12 folks who will sort of take on the leadership and management role. Spokane has a lot more partners than our Rural Collaborative, so we are needing a little bit more of a leadership team to make sure everything gets off the ground there. Here you can see a template of the budget. We're trying to make this just as simple as possible. We have 4 categories for which you could propose to spend funds. The first is administration, so that's sort of the logistical things that it actually takes to run your collaborative. Project management is going to look at what funding do you need to actually move the work forward. That might look like supporting an organization to take on the role of writing the collaborative, like writing this document, maybe paying for time to actually have somebody be the driver of the work, sort of being the project manager to make sure that the collaborative work is moving and gets submitted on time. We have another category for provider engagement, participation, and implementation. So this might look like things that will support helping your partnering providers stay engaged, participate, or actually get their work done. And then finally, provider performance and quality incentives. So you may choose to select some sort of, you might have an idea for how you want to incentivize providers to do certain activities or get certain elements of the work done, and you could show us here how you would lay out those incentives. Or perhaps rewards for performance or hitting certain milestones throughout your collaborative work. Here is that section I mentioned that has the collaborative member signatures. So there's about a couple pages in there where you just, everyone has the ability to sign. My recommendation for this is we really see that this, there needs to be a collaborative meeting where everyone is in the room actually discussing all of these different elements. I know all of our rural collaboratives have, standing meetings set up for their next health coalition. So we'd like to see, I just think logistically it's easier to get these signed in person, but we're also happy to help support the electronic signatures if needed. And with that wraps up the asks for the collaborative level plan. So that's what you will all be submitting as a collaborative. So I'm going to take everyone off mute again and check in for any questions before I dive into talking about the individual partnering provider plans.
Yeah, Hadley, this is Jenny Smith.
Hey.
Hi, I have a question. If you can go back to the budget template.
Absolutely.
On the provider engagement, participation, implementation, I was hoping that you could, you gave a pretty broad description there. Can you give us some more examples?
Yeah, so I think this could be, when I think about engagement, actually BHT took the style of, we gave each of you a certain amount of funds for submitting an MOU, and that counts to us as an engagement and participation payment. So we were essentially incentivizing folks to participate using that MOU payment. So that's one example of something you could use for engagement or participation if maybe you want to incentivize or reward folks for actually participating. I think some other examples that are key for implementation would be some sort of investment that you might want to make across the county that supports all the providers in implementing their projects. Maybe that's paying for some sort of training, wanting to purchase some sort of technology, or something that would actually help providers start the work, start implementing. Does that help a little?
Yeah, thank you.
No problem. Any other questions?
Yeah, Hadley, so there was some mention that this was the payment throughout the demonstration project, some possibility that there might be some chance to extend that. I think I remember hearing something like that. Has there been any further discussion about that? Is this intended to be an ongoing position or ongoing effort as far as like the program management lead position, that kind of stuff?
Yeah, we definitely anticipate that the management lead will be in place for the full, next 4 years of transformation. We have really only allocated payments to support the collaborative for year 1, and it won't be until, probably the fall or early next year that the waiver finance team starts looking at allocations for year 2. So we will continue to allocate dollars for further years of support. And we just haven't done that yet because we don't know what the needs are going to be later on. So this really is just intended to be a budget for year 1, so just through the rest of this year as we're supporting the planning work. And then once we have the actual plans themselves, we'll start to detail what activities are going to be done both at a collaborative level and for each partner providers. We'll have to go back to waiver finance and sort of develop some more funding allocations for the actual pulling off the work.
Great, thank you.
Any other questions?
Yeah, Hadley, this is Jenny again. I'm sorry. So you just said that, so this budget expense that we felt is for year 1. Are you talking 2018 or are you talking, on a different calendar?
Yeah, so this is through 2018.
Through 2018. Can we include stuff that's already been expensed?
That is a really good question. I had not thought about that. I'd love to just check in with Allison to see if that was her intent in this, and I will include that on the FAQ that we send out.
Thank you.
Great point, Jenny. All right, so with that, I'm going to move us back into talking about the individual partner plans. So rolling along. So these partnering provider transformation plans, again, they sort of lay out the same framework. They're going to start with a focus on the four projects. And at this time, we are only asking partners in a primary care or behavioral health setting to fill out these projects. But we fully expect, like I said earlier, that other partners are going to show up in these as sort of partners who are supporting the work. You'll see in the elements of a lot of these projects that they do require linkages to social determinants or other community-based organizations in order to be successful. If you are a partnering provider who is participating in more than one collaborative, so you are active in more than one county, you will have to submit a plan for each county. However, you can include multiple settings in one plan. So let's say you are both a behavioral health and primary care provider in Lincoln County. You only need to submit one plan. You can have both settings in one plan. However, if you are a behavioral health and primary care provider that operates in both Lincoln County and Spokane County, you would have to submit 2 plans, one for each county. So once again, we're asking for just a general overview of your organization. Here you'll see transformation plan contact name. Again, we have sort of 2 asks here. So there's the partnering provider name, it's really just the name of your organization. And the transformation plan contact is going to be the actual person who is submitting this transformation plan as the lead point of contact for the ACH and BHT. So that's who you want me and my team to be contacting when we have questions about the work that you're going to do or are going to do any sort of back and forth on your plan. So make sure you think think wisely about who you pick there. So then we'll, just a quick description of your sort of setting and the work you do. Are you primary care or behavioral health or both? And then a brief description of your organization and your mission and the regions that you serve. Here with just a quick check the box of which projects you are anticipating to submit a plan for. If you are not submitting for any of these three, we'd like to hear an explanation as to why or what you do plan to do that's going to contribute to transformation. And it's very important that I stress here that we need to see that all of these plans are aligned with the framework that came from the collaborative level plan. So again, the reason that we're asking the collaboratives to develop and submit their plan before the individual partnering providers start their own plans is so that we are starting from a place of alignment and that the collaborative can really set a framework for all the partnering providers to fit into so that it remains aligned across the county. We're asking for some transformational leadership and oversight, so that's really just a commitment that you have. We're asking for a transformation manager. That's, again, that person who's going to be the lead contact. We really need to make sure that participating in the collaborative meeting, so actually sitting at the collaborative table, is a person with the decision-making authority within the organization. This work is going to move really, really fast. And in order to make sure we don't have too many meetings, we need to know that in every meeting we're at, we have people there who are capable of making decisions on the spot so that we don't lose time in back and forth or having to go back to our organizations to make a decision. So discuss amongst yourselves in your office who is the best in serving for that role. And we're asking here that you provide just a short bio and some relevant experience so we can sort of know who we're going to be working with. In the past, we have been asked to give the healthcare authority bios for the folks who are supporting our work. So we're asking for this now in case they ask that again. We also like to see a quick description of your quality improvement capacity. So what current resources exist to support quality improvement? Do you have staff that are trained in QI? Do you have maybe technology or current practices that's helping you do quality improvement? And really, what added capacity would you need in order to support your work in monitoring the projects as we move forward and making sure we're seeing and tracking improvement? Here we are asking for some quick sort of summary statements across all these different areas of transformation. So here you can see some of sort of the key elements of transformation as a whole. First, we're health equity, which, as I said, is really fundamental and needs to be woven into all of the project areas. Community-based care coordination, again, while it is called out as its own project, it's also what we see as an anchor strategy across all 4 project areas, the need to better coordinate care. So what's your sort of general summary to approach the required elements? And then as we move further down here, you see the anticipated challenges for Domain 1. So Domain 1 of the transformation activities really have to do with those foundational supports for transformation. So that's population health management, which is really talking about health information exchange. Workforce and readiness for value-based payments. We would like here for you to quickly describe what challenges you expect as you're working on these goal areas. So what challenges do you expect to sharing information? What challenges for technology infrastructure do you have? Workforce challenges and anything having to do with readiness for value-based payments. Here we have just a general other anticipated challenges. If you could share, what you're worried about, what might trip you up in this work, and then any requests for technical assistance. Again, we'd really appreciate thoughtful, honest answers here so that we can start to determine what it would be best for BHT to use some of our dollars for in supporting all of our providers in training or other infrastructure investments that can help the whole region. Here's where we call out asking you to describe how your individual partnering provider plan is going to sync with the collaborative framework that your collaborative established in their collaborative plan. We need a budget justification. You will find attached to your packet a Excel sheet that's pretty straightforward that's asking you to submit a budget for all the activities related to these different projects. And here we just need sort of a quick narrative that justifies the expenses that you listed in the budget. We have a quick question about whether or not you are participating or planning to participate in an accountable care organization. This helps us think about alignment with other efforts and sustainability models. And then really, as I mentioned earlier, you know, the metric about emergency department use is one of the most high impact metrics because it ties across all 4 project areas. So we're going to need to see that your organization has some sort of linkage to the emergency department, especially when it comes to diverting patients out of the ER, keeping patients out of using the ER inappropriately. So we'd like to just hear any of your thoughts, plans, or current state for linkages with ED departments. All right, so for each of the project areas, bidirectional integration, chronic disease, and opioids, I'll highlight again that we are not asking providers here to speak much on community-based care coordination because we really see that as an activity that needs to be handled more at the collaborative level. It requires a network of partnerships. So we are really focused here on the bidirectional chronic disease and opioid transformation areas that have more specific activities for primary care and behavioral health providers to take on in their own shops. So here we're going to be first asking for an aim statement, a specific aim statement for each project, and then ask you to lay out some of your plans for the key elements that we've identified in each model. So you'll see each section asks, there's sort of laid out in a table. We list the element that is part of the model, and then ask you to describe what is your current state capacity, what resources do you have today, what's already in place to work towards achieving this model, what gaps exist. Then we ask for your view and plan for implementation year 1, what resources, improvements, activities are planned in year 1, and how are you going to support this model. And we'd like to see here some lists of what milestones and timelines you'd see with implementation. So really, an example might be we're going to train our providers on, this element of the model by Q2 of 2019, something like that, where you can really see, here's the activity and here's our timeline for it. And then we want to see a little bit of thinking on your plans for years 2 through 4. So how are you going to scale this? We really, we don't need to see a lot of details. We recognize this plan is really meant to get us to implementation year. It's not meant to lay out the whole 5-year plan, but we do want to think that you're thinking how you can tie this to scaling and sustaining across later years and working towards a sustainability model for when the ACH dollars dry up and you need to find a way for this to be paid for in the system. All right, so getting into the actual sections themselves, here is an example with bidirectional integration. So we have, the description up above of who the target population for this project is. We'd like to see just a quick description of how you intend to target a population, who you're planning to reach, and how you're going to find those folks. We have a quick ask which model of bidirectional integration you intend to use. So again, our Provider Champions Council took a look at both of these models and made recommendations that we use sort of either the BRIE collaborative model or the collaborative care model. All of the links are live for the model, so as you're working through this packet, you can just be clicking the links there and be reading all of the elements of the BRIE collaborative model. We'd like to see a quick high-level description. We're really just looking for a page, no longer than a page if possible, of your overall plan. And I think it's important to note for a lot of these questions, I don't think it's necessary to do this in any particular order. You're probably going to find that as you dive into the elements first and think about completing each element, that's naturally going to translate into your overall plan. So you might want to, take a deep dive into each of the elements and work through that before you actually write your high-level overall description. And here's where I was asking about aim statements. So for each project, we're going to ask you to write at least 2 specific aim statements for the models you have selected. And we have, just a description here of what a good aim statement looks like, what we're looking for here, and you can click this link for some guidance on how to develop that. Here is what I was mentioning of sort of how this is formatted. So you can see if you had selected the BREE collaborative model, you would come down to this BREE collaborative section and then go through each table. So the first table includes element 1, integrated care team. This is the first element of the BREE collaborative model, and you would be asked to speak to how you are going to approach completing this element. Excuse me. So first, for your current state, you're going to explain what capacity currently exists, describe your current care team, what resources do you currently have in place that's going to support this element, and then what gaps exist. Then looking at, our building year next year, which will be our, first implementation year, we'd like a description of what resources and improvements you're planning for year 1. What team members, roles, just sort of describing how you're going to pull this off. And, again, as I mentioned, we need to see the inclusion of some key milestones and timelines. In our report back to the Healthcare Authority in October, we are really it's going to rest really on a work plan that includes milestones and timelines for each of these projects. And it's expected that the milestones, while they have given us a guideline of sort of the necessary milestones to meet the pay for reporting requirements, we must show additional milestones specific to each collaborative in order to create a successful plan. So we're not only having to show the general, what is the ACH region going to do, like what are our milestones as an ACH region, but we actually need to show milestones for showing off each specific project as well. So this is really going to help us build a detailed plan that satisfies the Healthcare Authority's needs for us. And then finally, this sort of performing years in the final 2 years of transformation. What further improvements are you going to add that's going to help this project scale? Again, we don't expect a lot of detail. There's going to be a lot of learnings in the first year as we start to pull off these projects that are obviously going to inform how we scale and build in the future, but we'd like to see a basic roadmap for how you're going to approach the project over the full 4-year period. After each project, we ask for just these 3 descriptor questions. The first of describing the plans for your partners. So really including some of the key settings for each project. So for bidirectional integration, we'd see linkages to pharmacy, emergency medical services, and other social determinants of health as potentially supporting your integration goals. So we would ask you to list who are your partners in this project and what role are they going to play. So if you are partnering with anybody outside of your own organization, describe that relationship and the expectations there. We're then going to ask for you to sort of comment on how this project is going to help accelerate health equity. So looking for how can you apply an equity lens in the selected activities that you take on. That could look like ensuring interventions are culturally aware or trauma informed. If there are opportunities for training or specific activities that might help you engage with a high impact population. We're just interested in your thinking here about how you can embed strategies that will combat health disparities as you roll out integration work. And then finally, we're looking for some comments on your sustainability plan. Given that the funds here are time limited, how are you going to make sure, what are your ideas for connecting to other funding sources? How is this helping get you ready for value-based payments so that you can find a way to make these activities sustainable in the future? So I'm going to pause there. It's really for the other projects for opioids and chronic disease, we ask virtually the exact same questions. They're all formatted in this way where you see the key elements of the model with the exact same table and questions breaking it down by current state, build year, and performing years. So in the interest of time, I don't have slides on the other 4 or the other 3 projects because they're all the same. So I'm going to pause here and ask if you have any questions on answering these project-specific questions as partnering providers. And with that, you are all off mute.
To do something around
yeah.
that. In terms of what does that look like?
Mm-hmm.
Any questions? All right, I'm muting you all again, and we'll get through the last few slides. So here is our timeline. We distributed the transformation templates last week. If any of you are shocked by that and did not receive them, please feel free to shoot me an email and we can make sure you got it. This is our second webinar that we have hosted. We intend to host another webinar on June 15th to deep dive more specifically onto the partnering provider plans. We expect at that time that you will have done some work to get your transformation plans done, and that might have created some new questions for how to approach the partnering provider plan. So we'll host another webinar Q&A then. The collaborative level transformation plan is due June 29th. So that is coming up faster than you might think. And then throughout July, we will continue to host another series of webinars, just creating time for Q&A, any back and forth needed on the partnering provider transformation plans. I also just want to make it very clear that BHT is really available to support the collaborative and individual partners as you are starting these plans. So please, if you have questions, feel free to reach out to any BHT staff member, and we can either, call and talk through whatever the issues are, or easily, set up a time to come meet with you or your collaborative and walk through the plans. We're happy to be available. Over the course of the first 2 weeks in July, BHT and our team of consultants will be reviewing the collaborative transformation plans, and by July 16th, we will notify the collaboratives of any outstanding questions or concerns that we have. So if we see anything missing, or we have some questions about how you're looking to approach something, we'll do some back and forth in that time to make sure we have absolute clarity on your plans, with the goal of getting everything finalized by mid-July, July 17th. That's going to give us enough time to turn the collaborative transformation plans into our semi-annual report for the Healthcare Authority, which is due July 31st. It's asking us a lot of questions, just making sure that we are on the right path to getting our folks filling out plans and engaged in the work. That partnering provider transformation plan will be due August 1st. So you will have, about 2 months after, well, not even that, just about a month after the collaborative transformation plan to build each of your own partnering provider transformation plans for those of you in behavioral health or primary care settings. And then the same period, BHT will use the month of August to review those partnering provider transformation plans. Remember, there are only 6 collaborative transformation plans, so that's where we think we can get some feedback back to you in 2 weeks. However, with the partnering providers, there's probably going to be closer to 50 plans, so it's going to take us a little bit of time to digest all of those and handle all of that back and forth. We will notify plans in the first week of September if we, again, have any questions or concerns. This will initiate sort of a negotiation period back and forth, making sure we have providers, aligned with with their collaborative, and that we have met the minimum expectations for each model. And we expect that around that time, we're going to ask the collaboratives to submit their first quarterly report, which includes updates on their transformation work so far. This will be pretty standard for the next 4 years, that we expect we're going to do a quarterly reporting period for each of our collaboratives so that we can get regular information to help us feed our reports to the Healthcare Authority on progress. And then at the end of September, early October, we have to submit our implementation plan to the Healthcare Authority. So that will be the aggregate of all of the work from your plans that aggregated on a county level. And then we will wait in October to hear that our transformation plan is finalized and approved by Healthcare Authority. And we'll use the rest of the winter in October through December to really work on getting actual contracts signed with each of our partnering providers, do any negotiation necessary to make sure we have all of the folks committed to their roles and expectations for their transformation plans. And then once we hit 2019, we get the ground running. I'm going to pause and unmute us here because this was a lot on one timeline. So if anyone has any questions, you're off mute. And hearing none, I'll move into the next slide. Just sort of a quick note on what's going to help you develop these plans. I expect that we will throw in 1 or 2 more webinars that are just about a Q&A, sort of an opportunity for anyone to hop on and ask questions they might have as they're working on their plans. From each of these webinars, we've developed an FAQ, so all of the questions that you all have asked me, we'll add to the FAQ with an answer, and we'll keep that updated just about once a week. So if you all have questions in general that you are calling into the office and asking, or emailing in and asking, we're going to keep adding those questions to the FAQ to try to have a place where, you know, all of our shared knowledge is stored. So we'll keep sending that out in the links. Don't forget about the collaborative webpage. So if you're at betterhealthtogether.org/collaboratives with an S, plural collaboratives, that's a private website that has all of the information and documents that you guys are going to need to fill out your plans. It's not searchable from our website, so if you just go to betterhealthtogether.org and click around, you're not going to be able to find it, because we intentionally wanted this space to just be for folks who have committed to participating in the collaborative. So I suggest you bookmark that page so you can go back and find it really easily. But that's going to be a place that you can see all of the documents if you're missing anything or looking for some more support. We are going to create a calendar of office hours when we have some free time as a BHT team, where you could come in and just drop in and chat with a BHT staff member to look for support. And again, we are always available for TA calls and questions about the models. Another important thing to note is we are working right now on a schedule of a couple informational webinars. We'd like to host a webinar on each of the 4 project areas with some subject matter experts. So folks who are actually have experience implementing these models, have some hands-on experience with them, so you all can both get a presentation, hear how it works for them, and ask for support, any questions. And so be looking for that schedule. But other than that, I know we're just about over time, so thanks all of us thanks everyone who's still here. I do want to ask if anyone has any additional requests for support, if there's something that BHT could do to help make getting these plans easier. I'd love to hear. So you're all off mute. If there's any more input for how BHT can be helpful, or you have any more questions on getting these plans submitted.
Yeah, Hadley, this is Jenny. Of course, I have another question. I just wanted to know, are these webinars being recorded, and will they be available also on the collaborative site if somebody should miss one?
Yes, this webinar is recorded. The first one was not, solely because I forgot to press the the record button. That's pretty much the reason why I did this second one, was so that I could guarantee we had one recorded up on the website. So by the end of the day today, we will have this linked on the collaborative webpage for you all.
Oh, that's great. And how about the one on June 15th? I know I'm concerned I'm not going to be at that one, but I want to make sure I can listen in to all the other questions.
Great. Yeah, we will make sure that one is recorded. My lovely staff team made a giant sign that said, "Don't forget to press record," that now sticks to the top of my laptop, so that I don't make that mistake in the future.
Thank you.
Any other questions from folks? All right, well, with that, I think I will let you all go. Thanks so much for attending. I hope this was helpful in sort of demystifying this transformation plan. Again, if you have any questions or need any support at all, please feel free to reach out to any BHT staff. And expect that by either the end of the day today or early Monday, you will have an email with an updated FAQ from the questions that came out of today's webinar and a link to this recording. Thank you all. I hope you have a lovely Friday and rest of your weekend. Bye-bye.